So this is now time for our secondary assessments. If this patient has been emergent at this point, we are in the ambulance, we are on our way to the hospital, we are telling the hospital we're coming, we're getting vital signs, and we're doing a more detailed, what we call secondary assessment from head to toe on this patient. We exposed the patient earlier, right? We got our first findings with the patient. Now we're gonna go into details. So I'd like to share with you some of these details. We're first gonna check the patient's head, and we're looking for a DCAP BTLS as we're going along, right? So any sign of trauma here. Look behind the ear. Do we have any battle sign behind the ear, right? That could be sign of a bad fracture, head injury, stuff like that, right? Anything coming out of the ears. We can do a pupil exam of the patient. Are the pupils normal? Are they constricted? Are they dilated? Are they equal? Are they unequal? Are they reactive, right, with the pupils? We can go on here, looking at the nose, make sure everything's good there. Look at the cheekbones, the mandible, the actual mouth. We can open your mouth, light in the mouth, right? Scan down to the neck, feel the spine, the back of the neck. We can listen with our scope we have right here to our actual trachea, right? We can gather lung sounds on this patient, right? We get lung sounds back. Are they normal? Is there wheezing? Is there rales? Is there rhonchi? Is the chest rise and fall equal on both sides? Is one side absent and one side clear? Like a pneumothorax, that would happen, right? We're gonna palpate their abdomen. We're gonna examine the abdomen, right? We're gonna move down to the pelvis. We're gonna scan the legs. Any pain in your legs? We're gonna scan the arms, right? We're gonna get pulses along the way while we're doing all this. Then don't forget, we're gonna bring the patient forward and we're gonna scan the patient's entire spine on the back, right? So that's gonna be a quick little secondary assessment. Now, there are so many different exams and things you can do on the secondary assessments. But the main thing is a more detailed look in your patient, and you're doing that during transport.